Hey, good afternoon and welcome to our Friday edition today of our Facebook Live series. So we're going to be talking to you today about medical food versus supplements. And all of you are certainly familiar with supplements, and we've taken things like multivitamins, probiotics, those kind of things, but I will bet not many of you are familiar with medical food. So we're going to dive into that, talk about the importance of those. First off, let me introduce myself. I am Dr. Alex Callio. I'm the clinic and owner and clinic director here at Comfort Family Chiropractic in Lincoln, Nebraska. I've been practicing for over 20 years, and certainly one of the mainstays that we have used over much of that time are both medical foods and supplements. And especially, again, we kind of mentioned in the intro the importance of supplements, and we're going to talk about the differences between those two things, and especially when it comes to medical food, some of the different conditions that these things can treat. We're going to talk about cholesterol issues, both high and low, heart disease, diabetes, and blood sugar issues, bowel and gut issues, IBS, Crohn's, those kind of things, and certainly just in general weight issues. Certainly all things that when we talk why a medical food would be prescribed and how those can be beneficial for those things. So if you know anybody suffering with high cholesterol, taking a statin drug, has heart disease, has weight issues, maybe bowel gut issues, make sure you tag them in this video. It's going to be some good information for them to get and to see if there's something there that could really help them maybe not only feel better, but potentially even get off of some of the medication. So that would certainly be a good goal for today. So tag them in the video, share this out there, in social media world, let them see the information, and certainly then they can get in touch with us a little more directly if they have specific questions. So when we talk difference of a medical food and a supplement, supplements really are things that are given to help nutritionally support a relatively healthy individual. Things like a multivitamin, a probiotic, maybe vitamin D, some of these kind of things. All are good supplements, and probably almost all of you out there at one time or another have taken a supplement. You can walk into the store, you can grab it off the counter, off the shelf, and self-direct that and be able to purchase that. A medical food is much different. A medical food is really designed to do a few different things. One, it is prescribed specifically to nutritionally support a specific disease or condition. So this isn't something that you just grab willy-nilly and take. It is prescribed specifically to nutritionally manage a specific disease or condition. It also has to be done under the supervision of a physician, whether that be a medical doctor, a chiropractor, those kind of things. And then, really thirdly, it's kind of designed to help us fill in the gap, those that have trouble absorbing and digesting specific nutrients. So they aren't able to control a lot of these conditions just with diet changes alone. So we kind of come back to talking about those conditions, the dyslipidemia, the high cholesterol, the heart disease, weight problems, IBS, Crohn's, a lot of those gut function issues. So we're going to talk specifically about some of the direct medical foods that we use in treating these conditions, and certainly some of the benefits from that. So one of the things when we start looking specifically to start with at cholesterol, how many of you, certainly if you're watching this or out there, are taking a statin drug, again, make comments about it here below. So if you're taking a statin drug, let us know, one, how it's been working for you, but how you feel on it. A lot of times we'll have patients that will discuss how sore they are, muscle problems, some of the side effects of the statin drugs, and many times still trying to control that cholesterol level and certainly their risk for heart disease. One of the medical foods that is prescribed for this is called Ultrameal Cardio 360. Basically, this is the medical food that is specifically designed for lowering cholesterol. Not only lowering your bad cholesterol, but increasing your good cholesterol. So getting those cholesterol ratios improved is one of the best ways to lower your cardiovascular risk, especially when it comes to heart attack, those kind of things. Not even necessarily your total number, that's the issue. It's the ratio in your good to bad cholesterol. So the Cardio 360 is specifically designed to support and lower your cholesterol. Again, one of the main differences between a supplement supplement and the medical food is the medical food has been documented, shown, and approved through the FDA to be able to do what it says. Meaning we can say this will help you lower your cholesterol versus a supplement, which you recall if you read on all the labels, all say this is not designed to diagnose, treat, or things, any type of disease. Medical food is different. It is specifically designed to treat that disease. So when we look at a natural replacement for trying to get people off of statins, that's one of the main things that we use, many times in conjunction with modified diet, exercise, those type of things. This medical food is just absolutely superb at helping to lower bad cholesterol, increase good cholesterol. It's one that I use myself almost every day to help maintain, those good healthy heart levels. So that is one specifically when we look at heart disease, we look at cholesterol. That's a great adjunct. It is just it's a powdered shake basically. We can use that as a meal replacement or as a standalone by itself if we're keeping calories low. We're still using it for weight loss, some of those kind of things. Otherwise, I use it as my breakfast, and I will mix in some other fruits, kale or spinach, those kind of things. Really help increase that nutrient profile and really get that flavor up good. But the flavors with these are typically pretty good. It is not a milkshake. It does not taste like a milkshake. There is very limited sugar in these things. So, the flavor profile, again, is not going to be like picking up a chocolate shake at Sonic. But typically they still have very good flavor to them and designed to, again, really help treat that disease process that we're looking at. The other one, one of the other main ones that we use an awful lot is called Ultra Inflammex. And this one, the Ultra Inflammex, is specifically an inflammation reducer. It's used specifically for gut inflammation. So when we start talking Crohn's disease, IBS, the irritable bowel syndrome, those type things, a lot of bloating, distension, all that gut function type issue, that Ultra Inflammex is one of the first things that we go to. So again, it's a shake type format. We use that as a meal replacement or in between, but any type of gut function issue, that Ultra Inflammex can be extremely important in helping to calm that. We'll even use this in spurts with things like reflux, and some of those type things too. Again, with a modified diet, with exercise, some other things that we'll look at there. But many times that Ultra Inflammex is the medical food that we will use in conjunction in treating a lot of those gut function. We'll even use that sometimes with our really heavy duty arthritis patients, especially like rheumatoid arthritis, helping to get a lot of the joint inflammation and body inflammation down too. We mediate that through the gut. It will help to drop some of those body inflammatory markers as well. So the Ultra Inflammex is fantastic for that. I don't have it here, but there is a specific medical food for controlling glucose and blood sugar responses. So our diabetics out there, when we start looking at how do we control our blood sugar and start getting those parameters down, there is a glucose control medical food that is, again, specifically used for that, again, in conjunction with diet, in conjunction with some of those other parameters too. But we want to start limiting these big ups and downs in our glucose levels based on what we're eating through the day. We manage that through diet and the medical food. We have a really good response rate with that, and in starting to cut down the amount of insulin, things that are getting used on our diabetics, especially for our type 2 diabetics. You want to start reversing that. Add that product in with our modified diet, and you've got a really good 1-2 punch to kind of reverse that whole process, really heading around. And then many times, those are probably the top 3 that we use in terms of medical foods. We have kind of an everyday support that is basically just called an Ultra Meal Daily Support. It's a really good, healthy, low allergenic protein. It's a pea and rice protein mix. And cuts out a lot of the allergic reaction that we get many times with a whey or dairy-based protein, and then getting into even some of the again, just reactionary responses that many times some of our gut compromised patients have, that when we get them into more of just a supportive mode, that daily support protein works really well, over the course of longevity use and over time. So many times we're using these for those specific conditions, but then any of these can be used when we start looking at weight loss. And especially when we, in our office, when we have so many of our patients that are coming in not only with these disease conditions, but then it's back pain or neck pain or headaches or some some of these things that brought people in as well, that when we can combine our direct treatment for those issues, but now looking nutritionally and with the medical food product to get those other inflammatory markers and things under control, really over time where we see that long-term health benefit and health stabilization over time. So, wherever you are, if you are dealing with other factors like diabetes, cholesterol, weight, gut issues, make sure to talk to your chiropractor about using a medical food. If you're in our area and certainly have not done that, come talk to us. Give us a shout. You can find us on the web at comfortlincoln.com. You can call us direct at 402-484-5166. And either myself or my associate, Dr. Jared Swanson, both of us can talk with you about not only getting maybe your aches and pains kind of headed in the right direction, but some of these other disease processes, and see if we can start working scale in the right direction, start having some of these numbers in the right direction, and see if we can get you the help that you need. So again, my name is Dr. Alex Callio with Comfort Family Chiropractic here in Lincoln. We hope to see you soon. Enjoy your weekend.